know what I'm doing with it, and I know how to use it. Okay? You got it, right?
Yeah.
Do it a couple times where you feel comfortable with it. Now your air water syringe has 2 buttons, right? One button is just for air, and one button is just for water. So you get either a stream of air or a stream of water or a burst of air, or you could do the both combination, and it's like a spray, right? Kind of like a hose, all right? Like a little power wash in the mouth. Our air water syringe tip. After that, you have your mouth mirror. Not just your mirror, because we use mirrors also at our offices. People want to see their mouth and their face, how their smile looks or whatever.
It's called an air water syringe too.
Yes, air water syringe. So here just says air water syringe. So the whole thing there, that's the air water syringe. All right, then we have our mouth mirror. Okay, so again, 2 different. Okay, the mouth mirror has 4 functions. I want you to be able to tell me those 4 functions. If you only give me one, I'm just gonna, and because of the points, but because of the knowledge, I want you to know what you're doing. All right, so one of the things that you do, one of the things that you use your mouth mirror for is called retraction, when you're pulling away. So when you're holding back the cheek, okay, like this, that's like the back. You see where your hand is in front of the mouth. The only time you're going to place it like that is if you're trying to see on the side or the buccal of the teeth, meaning if you're trying to see the teeth on this side, right, this part of the tooth. Because then you'll go with your mirror and get into the mirror to see an area of the tooth that you can't see directly. That's indirect vision. Okay? So far we've talked about retraction and indirect vision. Another example of indirect vision, when you're driving and you look through your rear view mirror, that's also indirect vision. You get the concept? Mm-hmm. Okay. So that's indirect vision. Now the other thing that you're doing, sometimes you have to suppress the tongue down, right? Because let's say you're working down on the lingual side of these molars, and you have to suppress the tongue down or this way or that way, either way. By suppressing the tongue, you're protecting the tissue. So the mirror also helps you protect the tissue. So indirect vision protects tissue and retraction. And the other thing it does is, you know how you have your light, right? And sometimes you just can't shine in, let's say, the back or the lingual area of the teeth. You use your mirror. You see how it... So indirect vision, tissue protection, retraction, and illumination. Okay? So you can pass it around. That is your mouth mirror. Okay? So much harder. So usually, for right-handed people, we're going to always use our left hand for our mirror. And if you're on the operator side, you're still going to have to use your right hand for your mirror. So you're going to have to learn to use your left hand for the mirror. You're going to have to learn to use your right hand as your working hand. Meaning, you're going to pretty much be doing this. Okay? Retracting and then working with your right hand. Always remember to use your pinky as a fulcrum, meaning as your anchor. Okay, so your hand isn't shaking in the air. Okay? You're going to learn to use that. Alright? So the next thing on our list is an explorer. This instrument in particular here in my hand, it's a double-ended instrument, meaning it has one thing on one side and one thing on the other. Okay? Now this is the side we're going to... Let's put this pen right here. Okay, so we don't lose that page. We're going to go into the explorer. It's going to be in your chapter. In your chapter, let's say chapter 34. Okay? there's a cavity in that tooth. So they put it on the side, they put it on, anywhere where there's like a little pit or anything of that nature. We're going to go ahead, if it sticks or if it's really soft, okay, that's more of an indication that there's a cavity there, okay? Because you have to remember, the enamel, there's no such thing. People do not have soft teeth. They have teeth that decay, and that's what becomes soft, the decay, okay? And going down your lips, the next thing it indicates there to you is the cotton pliers. They call them cotton pliers